Hello, everybody, and thanks for joining us on the Night Team tonight. I'm Doug Profit. Across the country, it is a race between the vaccine and the new COVID variants that are out there. As health officials warn of a possible fourth surge, President Joe Biden is moving up his deadline for states to make all Americans eligible for the vaccine by 2 weeks to April 19th.
Let me be deadly earnest with you. We aren't at the finish line. We still have a lot of work to do.
Amid that push for vaccines, one Kentucky pharmacy we found is calling the Johnson & Johnson vaccine revolutionary. Focus investigative reporter Paula Vassan is showing us why the demand for this single-shot vaccine is unprecedented.
It's a special day for this pharmacy in Hillview, Kentucky, because they're getting their first batch of the new Johnson & Johnson COVID-19 vaccine.
There she is.
Pharmacy owner Rebecca Fletcher has just one regret.
Next week, I'll definitely order up.
She ordered 100 doses, thinking it would take a week to get through. They got snatched up.
You ready?
I'm ready.
In just 3 hours.
Is that surprising to you?
It's very surprising. I didn't know there was such a need.
How is this vaccine unlike the others?
It is different in so many ways.
Perhaps the biggest difference of the Johnson & Johnson vaccine is the way it's stored. It goes into a fridge instead of this temperature-specific freezer. And not only can the Johnson & Johnson vaccine be stored for longer, up to 3 months, it's also one shot instead of two. That convenience means these phones are ringing off the hook.
I would say about 30 calls an hour.
60-year-old Stephen O'Brien got one of the first appointments
I got the Johnson & Johnson vaccine.
because he wanted to be one and done.
I suffer with Crohn's disease, and my immune system is really bad. And it's hard for me to get out of the house. It's horrible.
Health experts believe the J&J vaccine will help people like O'Brien the most. People who can't make 2 separate trips over the span of about a month to get the Pfizer or Moderna vaccines. And since the J&J vaccine can be stored and transported more easily,
It's a 0.5 ml.
Fletcher can take some doses directly to the homes of her most vulnerable patients.
Those patients have a hard time even getting it at their house.
And that's why this is a game changer. According to the CDC, around 20% of Kentucky is fully vaccinated.
Yay.
There we go.
There you go.
A ways off from what experts estimate is needed to achieve herd immunity. That happens when enough people become immune to a disease to make its spread unlikely. The country's top infectious disease expert, Dr. Anthony Fauci, has said COVID-19 herd immunity might be reached if around 70 to 85% of people are immune.
I also feel like there's a lot of work to do still. So I'm not throwing a party yet, but soon.
But judging from the excitement over this J&J vaccine,
We have all scheduled the 100 Johnson & Johnson vaccines.
Fletcher anticipates throwing that party sooner than she thought.
Do you believe the Johnson & Johnson vaccine will help us reach herd immunity and let us get back to normal faster?
Yes.
And it's that desperation for normal, whatever normal looks like after this pandemic, that makes Fletcher continue to work 12-hour days.
I'm excited to get those people vaccinated.
It's why she had a baby in December and came right back to work 2 weeks later.
I know that it's my responsibility and my duty to help the community.
It's why when she got COVID while pregnant, she joined a research study to help others.
I want to mingle with people. I want to mingle with my patients. I want to talk to people, normally and back to the way it used to be.
How quickly do you think that'll happen?
Well, hopefully by Derby so we can all enjoy each other's company.
What determination to help her community. We reached out to Kentucky's health department to see how the J&J vaccine may impact when we achieve herd immunity. They couldn't give us an exact timeline, but infectious disease specialists I've interviewed predict a return to normal by late summer if we continue getting vaccinated and wearing masks out in public. For Focus, I'm Paula Vassan.